Welcome to First Issues. Every day, work characterizes about 80% of our lives. From Monday to Friday, we're running after a deadline, chasing the next career achievement, trying to climb up the corporate ladder. Why? Because this has led to an increase in isolation and a loneliness epidemic, according to the World Health Organization. Social isolation and loneliness are widespread, with an estimated 1 in 4 older people experiencing social isolation and between 5 and 15% of adolescents experiencing loneliness. Needless to mention is that a large body of research shows that social isolation and loneliness have a profound impact on physical and mental health, the quality of life, and longevity. The effect of social isolation and loneliness on mortality is apparently comparable to that of other well-established risk factors such as smoking, obesity, and physical inactivity. In countries like South Korea, where older people would die alone and only be found months later, prompted government to pull all the stops to fight this growing problem. They committed over $300 million over the next 5 years to create an environment where no one is lonely. Besides the financial investment to fight this growing concern, how else can social isolation and loneliness be tackled? Pharmacologist and consultant cardiologist Dr. Kiran Bhagat shares his thoughts. We're having this topic on the basis of loneliness and social isolation having an impact on one's overall health. What is it about social isolation and loneliness that impacts one's health, and how does it do that?
Health can be defined in lots of ways. It's the biological, it's the social, it's the emotional, and it's the mental health. So I think it's important to understand that loneliness and isolation can induce problems throughout that range. So physically it can produce physical problems, which we can talk about. It can produce emotional problems. So loneliness can induce depression. It can induce a sense of severe sadness that verges on even the temptation to take one's life. And loneliness can affect your mental status. So, you get what we call brain fog. You can't think properly. We know that the elderly that get lonely, if they have mild dementia, the dementia progresses faster because they're isolated, they have nobody to talk to, they have nobody to communicate with, and so it drives them into that dementia even faster and even further. And we know from a physical perspective, if you're lonely and you're isolated, you tend to do things that you don't normally do. You eat more. If you are indulging in alcohol or tobacco, you smoke more and you drink more.
The World Health Organization has actually warned that there's a possibility that loneliness could be considered a global pandemic in 2025, no less. That's next year, right? So what do you think are the long-term consequences of, loneliness if the issue is not addressed?
With the elderly, for example, the long-term effects are depression, the effects are worsening dementia, the effects are malnutrition and disease because they don't eat well, they're not fed well, they don't exercise well, they are much more likely to fall because of weakness, because they're sitting all day, they're not talking to anybody, confusion, not going to take their medication, missing their medication, skipping their medication, taking the wrong medication. These are all the effects of isolation. We see them in our hospitals where occasionally they're brought to the hospital with one or younger members and we see a bag full of tablets and you realize they haven't taken any of the tablets. In the younger population, I think it's an issue of not doing well at work, losing your job, being demotivated, not performing very well, losing ideas of creativity. Social isolation because you're not mixing with the crowd. So I think these things also are important in terms of detecting them, in terms of having in the workplace a human resource wellness committee that looks at loneliness. I mean, the wellness committees currently we have in our country tend to look at physical activity, looking at eating and lifestyle issues, but need to tackle this as a mental issue that, is your mental state right? Are you managing to communicate? Are you managing to interact? Are you having issues at home?
Let us talk about, the solution at individual personal level, right? How do we support people who are lonely? I mean, we're trying to build a sense of community here. How do we go about doing that?
I think in terms of, if we just take the groups again, if we take the elderly or perhaps the young as well, is encouraging to foster community spaces. With the elderly, we know that encourage them to go to church or social activities, encouraging them to have hobbies, encourage them to do things that they may have done in their younger years. For example, if they worked within the health sector, to go and assist other elderly people, care of the dying, palliative care. And there are many retired nurses, for example, that could do that are not doing that. Teachers to teach young children in terms of discipline, in terms of, extracurricular activities. I think these things can be encouraged by the government itself to say, these are the things we're going to do to foster greater interaction between the young and the old. In terms of the younger, I think the workplace, it's incumbent on the human resource department to always remember that this can be an issue if somebody's not performing well, if somebody's coming to work looking tired, looking fatigued, looking depressed, looking dopey because they've taken a sleeping tablet, losing weight, not engaging with their other co-workers, as to pick up these things that become actually eventually drivers of mental disease. So I think it's really more awareness and alertness that these things can occur and should not be marginalized.